evening and welcome to our virtual town hall meeting. I'm Rob Pitts. I chair the Board of Commissioners of Fulton County, and I want to welcome you again on behalf of the entire Board of Commissioners of Fulton County. On March 2nd, Governor Kemp announced the first 2 COVID-19 cases in Georgia, and sadly, both of which were in Fulton County. Since that day, the change in our daily lives has been rapid and far-reaching. As of today, there are 184 confirmed cases in Fulton County alone and 1,026 throughout the state of Georgia. That means that 20% of the cases are right here in Fulton County. And as such, we are in fact the epicenter of the virus in the state of Georgia. In the coming days and weeks, more and more of us will know someone who is either directly impacted by this virus, either directly or indirectly. And also because of social distancing guidelines and shelter-in-place directives, many of our small businesses in the county have been affected. And our hospitality industry and our travel industry, in particular, our restaurants, have been severely impacted. And as we consider our response to this unprecedented event, we're balancing the safety of our residents and employees with the need to continue to provide important government services. We've taken a few steps to date. For example, we've closed all of our senior centers. We've closed our libraries to visitors. We've closed all Fulton County-owned facilities to the public. We've implemented a teleworking policy here for our employees. We've also opened our first drive-through specimen collection site. And just this afternoon, consistent with action that was taken by our Board of Health, I've encouraged every mayor and every member of council of the 15 cities in Fulton County to adopt uniform rules and regulations regarding what our citizens should and should not do and should not be able to do. So to begin our town hall meeting this evening, I want to ask our county manager, Dick Anderson, to give us a little more detail about exactly what we've been doing here in Fulton County government. Dick.
Thank you, Mr. Chairman, and good evening. As we continue to adjust our operations, our focus is predominantly on public health and on public safety. So starting with public health, we continue to hold daily calls with Dr. Sandra Ford, the public health director, and her staff, and now an integrated emergency management command structure that we put in place. As the chairman said, we started our first drive-through specimen collection facility, and that was at 1 p.m., last Thursday. The good news there is we're beginning to see patients, beginning to see throughput through that facility, and we expect it to increase. We are also planning our second site as that site comes up to capacity. In addition, we've established a warehouse for the receipt of PPE or personal protective equipment. That warehouse is now operational. It took its first delivery today, and it also had its first distribution today to one of our key hospitals in Fulton County. In public safety, our courts continue to operate with a focus on managing the jail population. So bond hearings, first appearance hearings, and coordination with Atlanta Police Department are its highest priority. We continue to review a daily report on the jail population, and we're pleased to see and report that that population has dropped over 125 in just the last week, now to a total population of 2,691. We want to stress that as that population drops, it's dropping with nonviolent offender releases. We're also enabling video conference now exclusively, as opposed to in-person hearings with our district attorney, public defender, and court officers. And again, that's effective tomorrow, Wednesday, March the 25th. Also at the jail, we've restricted all visitor access. We've instituted temperature testing and observation for new bookings, and a 14-day quarantine period for any being admitted before they enter the general population. And of course, we're aggressively cleaning the facility now on a daily and sometimes hourly basis. We have had one confirmed case of COVID-19 positive at the jail. That inmate has been quarantined along with any contacts with either our staff or fellow inmates. And then lastly, we continue to work, again, a process for reducing the jail population overall with a focus on nonviolent offenders, so to reduce the risk. Through our Atlanta Fulton County Management Emergency Management Agency, we are coordinating all resource requests for equipment and supplies across Fulton County agencies, hospitals, and other entities. And we continue to communicate with our cities and school systems, both with a daily email update from our emergency management director, as well as a series of phone calls when necessary. Seniors is a specific emphasis that our Board of Commissioners have made consistently, and certainly now during this crisis. We have surveyed 500 of the most vulnerable seniors that attend our programs in Fulton County, and over 225 of them have indicated an interest in a daily meal service, and that service began this week. They are delivered through Project Open Hand, and again, we're pleased to have them as a partner. In addition, though, we are surveying the 4,000 additional seniors that generally are participants at our multi-purpose centers. Many of those are beginning to indicate to us that they also are interested in daily meal service, and those services began this week, both with a curbside pickup option and then also with a delivery option through our partners Piccadilly and Transdev. So we're pleased to see that come online. Lastly, we've been asked by our board to explore all other options to serve seniors in high-rise facilities in Metro Atlanta, where food service may not be readily available to them. So we're exploring those options now, working with the Atlanta Housing Authority, and believe that we will have some creative solutions to offer in the next week. Libraries, of course, is one of our most heavily used services, and that continues even in this crisis situation. So while they were closed to the public starting last Monday, the 16th. We, though, now want to say that we have many of our offerings online. Certainly our books and materials have always been in that digital format, and we're seeing a significant spike. But we're also doing things like FaceTime, or excuse me, a story time on Facebook. So we encourage all of our citizens to take advantage of that service in that format. Taxes is, of course, something, and the ability to renew your tags, which is always critical. We have online options that facilitate that, but I also want to remind you again of kiosk locations in select Krogers across Fulton County. So go to our tax commissioner website and look for that Kroger location nearest to you. And I think you'll find that service to be very easy and very accessible. For homestead exemptions, those are still due on April the 1st from the state. So please do take advantage of the ability to do that online or through the mail to be able to complete those exemptions before April the 1st. And then lastly, as it relates to all these services, is the importance of our employees. And as you know, we have almost 5,000 employees that enable us to serve you as citizens. So in some cases, those employees are reporting on site if they're in public health or public safety or essential functions. In many cases, they are doing telework, which is, again, enabling us to do these services that I just described. And we've offered an administrative leave option of up to 80 hours, which now is very consistent with what the federal government has just put out as a requirement for large employers. So we continue to monitor the legislation that's coming through, and we'll have consistent policies here at Fulton County for our employees. But of course, like all employers, we both anticipate and have now had one employee diagnosed positive for COVID-19. That person is being following a protocol with our health officials with contact tracing and notification. In addition, we have 3 other employees that are now under medical review, and will follow those same protocols. Lastly, we do encourage you to look at our COVID-19 website. So now we have a web page that's dedicated not only to the information that we'll share tonight, but other resources and information as it comes online. So I think it'll be a great resource for all of our citizens. It's www.fultoncountyga.gov, COVID-19. Mr. Chairman, I think that's what we're doing operationally.
Okay, thank you so much, Dick. And now from, let's take a few comments and an overview of the Fulton County Public Health response from Dr. Elizabeth Ford, who is the interim director of the Fulton County Board of Health. Dr. Ford.
Thank you, Chairman Pitts. I first want to just give a snapshot of what's going on with COVID-19 at the state level. Georgia currently has 1,026 cases as of noon today. We get daily reports both at noon and at 7 p.m. So that number is expected to jump up while we're having this conference. We have 1,026 cases and 32 deaths throughout the state. As the chairman mentioned, we have 184 cases of COVID-19 in Fulton County alone, which means this single county is responsible for 18% of the state's cases of COVID-19. For that reason, we have decided to become much more aggressive with our recommendations as they relate to physical distancing and have declared a state of public health emergency in Fulton County. The Board of Health has directed me as the interim district health director to limit gatherings to less than 10 people, to restrict to less than 10 people all non-essential businesses throughout the county, and particularly those that require direct human contact. Some examples would be barber shops, nail salons, massage places, spas, and things along that line. We are also closing all dine-in restaurants to only open for drive-through, pickup, or delivery. We are also encouraging faith-based communities to reduce their numbers to 10 or less, and funeral gatherings. All of these precautions are put in place to decrease the spread of COVID-19 throughout this county and to ensure the health and safety of all of our citizens. I wanted to share with you specific duties that the Board of Health is performing. We will be deciding in the morning what services are considered essential to the county, and we will share that, and that will be on the Fulton County website, and which sites will be closed in order to maximize service delivery to our community. We are also screening all clients that come into Board of Health facilities. Both staff and clients will be screened for temperature and symptoms. If you are symptomatic and you either are a client or an employee, you will be sent home or sent away from the center. We are also doing specimen collection, as Mr. Anderson mentioned, in order to determine who should be isolated and kept away from the rest of their family and friends. As we increase the ability to test throughout the county, it is reasonable for everyone to expect numbers to jump dramatically. And so right now we're at 184. Probably by the end of the week, we may be 300 or 400, because at this point, numbers are duplicating doubling every 2 days. And so at that rate, we should expect dramatic increases as the number of tests become available. Testing at this point is still based on a priority criteria, first of which are individuals referred by a primary care physician who then have a PUI number. PUI stands for persons under investigation. So an individual who has been screened by their doctor would then call the health department and receive that PUI number. At that point, they would be provided with location of the specimen collection site, and their specimen would be taken in a nasopharyngeal swab in their nose through a drive-through center. That test would then be sent to a laboratory, and the results would come back anywhere between 24 and 72 hours, depending on which lab it was sent to. It is our hope to expand that testing, the number of testing facilities throughout the county, but at this point, we are limited by the number of tests available. The other priority groups would be first responders who are symptomatic, and those who care for individuals who are at high risk for a negative outcome from COVID-19. And that would include our seniors who live in long-term care facilities and the homeless, for example. We are hoping that these measures that we are putting in place work to decrease the spread of COVID-19 and flatten that curve so that we can ultimately have some more rapid resolution of this pandemic. Thank you.
Thank you very much, Dr. Ford. And now for an overview of what Grady's responsibility is, I'm going to ask Dr. Kelly Carroll, who is the Chief Ambulatory Officer of Grady Health System, to join in. Dr. Carroll.
Thank you, Chairman Pitts, for this opportunity to talk to our community. We at Grady, as well as all the hospitals in this area and our government and community partners, have been working tirelessly to keep our community safe. So I want to first share some just very simple points for our citizens to follow. If you or your child gets sick, call your physician or pediatrician first before going to facility or going to the emergency room. This will ensure that you get a speedy attention and will also reduce potential exposure to COVID-19, both you and others. This will also prevent unnecessary crowding in our emergency rooms, which is what we're trying to avoid. All of this is a team effort. We all, every citizen, must practice social distancing to slow community transmission and flatten the curve, and to relieve the burden on our healthcare system and to prevent hospitals from exceeding our capacity. Testing people with mild symptoms of COVID does not alter care. Anyone with mild symptoms should do very simple things like stay hydrated, take fever-reducing medications as recommended by your doctor, and rest. Most importantly, if you think you have COVID-19 infection, keep a distance from others and stay in your home. This will reduce the risk of passing it on to others. Make sure you frequently wash your hands and cover your cough. And for all of us, we need to avoid touching our face, especially when we're in public. If you have symptoms, assume that you may have COVID-19 or some other respiratory viral infection that is always circulating in our communities, and take steps to avoid spreading that to others. Together, we are fighting to reduce this public health emergency and to protect our community. At Grady, I'm in charge of all of our outpatient facilities, and we have been speedily transitioning to virtual visits. So what virtual visits are is that instead of having a face-to-face visit with their physician, they are being called by their physician on the phone to do the visit over the phone. In the last week, we have transitioned many of our medical-oriented clinic and pediatric offices to virtual visits. Some of our procedural-based clinics are continuing to see patients who have time-sensitive needs. However, other elective procedures have been postponed. We will be piloting video visits very shortly. As well, we have a 24-hour nurse line for our patients to call, and most of our health system partners also have 24-hour nurse lines for their employees to call, their patients to call. Also, the Georgia Poison Center has a 24/7 line to answer COVID-related questions. So I am so thankful to be able to take this opportunity to talk to the community about the efforts that Grady is doing at this time. Thank you.
And thank you, Dr. Carroll, for your participation this evening. We all know the impact that the virus has had on our economy and therefore small businesses. So for an overview of what business relief is available, we want to hear from Terry Dennison, who is the District Director of the SBA Georgia District Office.
Good evening, everyone. Several weeks ago, the President signed into law the Coronavirus Preparedness and Response Supplemental Appropriation Act. And in that act, one of the provisions was for SBA to make available its economic injury disaster loans as a response to this situation that we're facing, particularly businesses and the negative impact it has had on their daily operations. The Economic Injury Disaster Loan Program is not new. We have used it along with some other disaster loan programs over the decades, usually in the context of natural disasters that are local in nature and in duration. This is a challenge for us in that this is the first time that this particular tool has been used in response to a pandemic on a national basis. The loans are available here in Georgia. They are up to $2 million in assistance that they can provide, and it's basically to help small businesses overcome the temporary loss of revenue that they are experiencing because of the social distancing and other practices that have had a negative impact on their businesses. The loans can be used to pay fixed debt, payroll, accounts payable, and other bills that cannot be paid by the business owner because of the loss of revenue that they're experiencing. The term on these loans is up to 30 years, and the current interest rate, which is set by law on a quarterly basis, the current interest rate is 3.75% for small businesses. One thing that makes this program different than our usual SBA, standard SBA loan program, is that nonprofits, private nonprofits particularly, are also eligible to receive the benefit of the EIDL loans, economic injury disaster loans, and the interest rate on those loans is 2.75%. The good news is that a few days ago, our administrator was able to implement across the board a one-year deferment for repayment, to start the repayment of these loans, to give business owners the maximum flexibility during this very challenging time for them. Also, aside from our disaster assistance loans, for those borrowers, those businesses that already have SBA loans through our 7A, 504 loan programs or our microloan programs, we have made provision for those lenders to provide deferments up to 6 months, and that is in place. If individuals want to apply for the loans, this can be done online at sba.gov/disaster. You can also print off the forms and fill them out and mail them in to our loan processing center in Fort Worth. But we are advising small business owners it's quicker and more efficient for them to apply online. If they have additional questions, they can call our toll-free customer service line, and that number is 800-659-2955, or they can email our disaster customer service at sba.gov email address. And I know there's some other things you may have heard of that are coming down the pike, and we'll be glad to provide that information as that happens. But this is the primary tool that we're using at the moment.
Thank you so much, Ms. Dennison, for that valuable information. Now, so if one finds him or herself unemployed, what are your options? So for an overview of unemployment benefit availability, Ms. Denise Beckwith, who is the Division Director of Unemployment Insurance for the Georgia Department of Labor, will give us some insights.
Good evening, and thank you, Chairman Pitts. The Georgia Department of Labor has been busy, as you can imagine. We recently passed some emergency rules, one being that we have mandated employers who have temporarily laid off their workers or reduced their workers' hours due to COVID-19 to file on behalf of their workers employer filed claims. These are called partial claims. This process will expedite the claims. Payments are normally released within 48 hours once the employer has filed the partial claim. And this also will eliminate the need for the worker to have to file the claim for themselves. Again, as I indicated, this was a mandate for employers to file these claims, but there are instances where employers are not filing the claims, so the workers can go on and file the claim for themselves. There's no prevention that will prevent them from filing. If they want to file a claim, they need to visit our website. at gdol.ga.gov. There is a link on our homepage that will say apply for benefits, and they can do this from their home as long as they have a computer with internet access or a smartphone. Now, we do understand some people may not have a computer or access to the internet. So we have set up a telephone filing process for individuals that do not meet these requirements. To do so, if someone needs to file a claim and they need to do it by telephone, they can call their local career center and ask to file a telephone claim. We have staff, our local career centers around the state, due to the health issues and the safety of our workers, we have closed those offices to the public. However, our staff are continuing to work in those locations. So if they call their local career center, they will, somebody will answer the calls and they'll process their claims. Now, one of the other rules that we have passed is eligibility. We have relaxed some of our eligibility laws to collect unemployment due to COVID-19. Some of these rules are for those workers whose child's school has closed or their daycare has shut down and they're unable to work due to lack of childcare. They potentially could be eligible for benefits. Those workers who have been self-quarantined based on medical advice or have a family member who they have to care for that has been quarantined. These are other options or other eligibility requirements that have been waived that you would potentially be eligible for benefits. Those, as I indicated, whose employer has to temporarily shut down due to COVID-19, again, these would be individuals that potentially could be eligible. Now, this applies for both the part-time and full-time workers. There is no, in some instance prior to this, there were some provisions that would only allow for full-time employment, but that has been waived. So this applies to both the full-time and part-time workers. We are working on some upcoming new emergency rules that will also have a great impact for our workers. We are possibly extending the number of weeks in which an individual could draw unemployment. Right now, our current laws only provides up to 14 weeks. We are looking at extending these for 26 weeks. We're also looking at waiving or extending the earnings allowance. Right now, our current rule allows a worker to work and earn up to $50 before we will deduct dollar for dollar anything from their weekly benefit amount. That is being looked at to waive that for up to $300. So a worker can still earn up to $300 and then collect their full unemployment check. That will be a great incentive. We know some employers want to offer supplement pays to their workers, so this will not impact their weekly benefit amount. In addition, we are continuing to process a large amount of claims. And so therefore, we are asking individuals that once they submit their claim, they will need to wait and check on the process or claim their weekly benefit or request their payments. They need to wait a few days in order for us to process their claim. If they have any questions, they should be reaching out to their career center or the unemployment insurance customer service line. All of this information, along with FAQs, can be found on our website at gdol.ga.gov. On our homepage, there will be an alert page. And if they click on that link, it'll bring them to all of our desk aids for employers to use to file partial claims, questions, copies of our laws, rules, policies. And we're continuing to update this page daily as we are receiving and updating our information. So again, I ask everyone to continue to check our website, our social media, including our Facebook, Twitter, and LinkedIn for updates. Thank you.
Well, thank you, Ms. Beckworth. Very good and very useful information for those who find themselves unemployed. So we're at a point now where we are ready to take questions from those of you, and I'm sure that what you have heard has generated quite a few questions. To answer the questions, in addition to those who are here with me, Dick Anderson, County Manager, Dr. Ford, Dr. Carroll, Ms. Dennison, and Ms. Beckwith, we have two other individuals who are online, Ms. Anna Roach, who is the Chief Operating Officer for Fulton County, and Ms. Sharon Whitmore, who is the Chief Financial Officer for Fulton County, will also join in and answer questions as they are presented. Helping us with the question and answer part of this town hall meeting is Jessica Corbett, who is our Director of External Affairs. So Ms. Corbett.
Thank you, Mr. Chairman. The first question we've received is about closure orders and some of the things that have been heard in the news. So people want to know what orders have been issued here in Fulton County and how will those orders be enforced? I think that's something that you and Dr. Ford may be able to speak to.
So the orders, as it describes closures are, again, gatherings of for less than 10 people we are limiting, and non-essential businesses. Essential businesses are still to be determined based on consultation with the Board of Health. So we will have to establish what are considered essential businesses, and that will be done obviously very shortly. In terms of enforcement, the Director of Public Health does have individual isolation orders that can be implemented, and there is a process by which businesses that are non-compliant would reach out to the state's website and then file a complaint if their employees are finding that their bosses are not being compliant with their orders as have been stated.
And Dr. Ford, one of the questions people had was how does the local order how does that relate to the governor's order that he issued yesterday?
So that's a great question. Actually, the governor's order reinforces what public health has been urging for a while, which is to have physical distancing guidelines established at a higher level than at the local level so that there's consistency throughout the state as opposed to district by district.
And Mr.
Yeah, and that question comes up about enforcement quite a bit, and because there are not enough law enforcement officers to enforce all of this. So, but these are serious times, and it's my belief that our citizens are going to take this seriously, and we're going to have to police and monitor each other. So if you see someone who is not the required distance apart, you say something. Now, if it becomes a repeat offender, then obviously you can take the time out and call law enforcement. But I think that the vast majority of our citizens of Fulton County will be mindful of and take heed and do the right thing.
To ensure their safety and the safety of
Exactly.
Thank you. We also, Dr. Ford, I know that PPE has been a topic of discussion. One resident wrote in and suggested that every worker and visitor to places like grocery stores be given a mask and a pair of gloves. Is that something that could reasonably be done?
I would love nothing better than to be able to distribute masks and gloves to every citizen. But as I'm sure Dr. Carroll will attest, we are short even for folks who are required to have masks and gloves. And so there is no way we would be able to accommodate everyone. And the point is that if you are symptomatic or feeling poorly, you should not be out shopping anyway. And so that's the main thing, is if you are this is what social and physical distancing is all about, is staying away when you're symptomatic. And so if you are asymptomatic, you have less of a need for a mask. But unfortunately, we just don't have enough masks to distribute to everyone who is requiring that.
And that question came to me today, actually a couple of times about, well, people in grocery stores and even at pharmacies are not wearing the gloves. Well, it's not that they don't want to. There's just a lack of availability now. And no one could have anticipated this virus having the impact that it's had. So we did not and do not have enough. But the good news is, as I understand it, help is on the way in that the private sector is chipping in to manufacture. Companies are retooling. This reminds me of what I read a lot about wartime, where the goodness of the people in this country, comes out. And so when you have companies that are stepping forward to change and forget about making a profit, they're making equipment now that's needed to fight this disease. And so once I believe that once the product is available and is distributed, that we will get our fair share, because we're a hot spot in the state of Georgia. We will get our fair share, and those who need the equipment will receive the equipment.
Thank you. We have also received a question that I'm going to direct to our county manager and our chief operating officer about the sanitizing of Fulton County facilities, particularly those facilities that are still required to be operational, such as the courthouse, or facilities that will be open to the public at a future time. So could you tell us about some of the procedures, and maybe we'll start with Ms. Roach, some of the procedures that have been implemented to get those facilities sanitized in an expeditious way?
Jessica, thanks so much for that question. And before I jump into the answer, I just want to take 2 seconds to thank any Fulton County employee who's watching this broadcast. The executive team here has a great appreciation for the flexibility and diligence that you guys have exhibited throughout this. So thank you for all that you do. Even prior to us closing our facilities to the public, our Department of Real Estate and Asset Management worked diligently in coordination with the Board of Health to make adjustments to the type of chemicals that we use to clean with our janitorial services. So even prior to us closing those facilities, we enhanced the products that we use to clean the facility. Subsequent to closing the facility, our cleanings continue as needed. And so I think the public can rest assured that when we do reopen for services, that our facilities will be cleaned to a standard that will protect them from exposure to this virus. I think that Dr. Ford can help confirm for us as well that there is a shelf life for this virus on certain surfaces. And so after a period of time, the virus is no longer alive on surfaces anywhere anyway. The last thing I'd like to share about cleaning protocols in particular are for those facilities that we've come across that have either suspicion or confirmation of a person with COVID-19 in that facility. We do have an established process for the leadership that operates out of that facility to request special cleaning from the Department of Real Estate and Asset Management. They have a vetting process for those requests, again, in coordination with the Board of Health. And then we do deep cleaning and sanitizing where it's warranted when a facility has been exposed to the virus that we know of and has been confirmed. So those are the 3 basic protocols that we've put in place so far.
And thank you. And Ms. Roach, while we have you on the line, I'd like to also ask you a question we received about the availability of behavioral health services in Fulton County, especially while people are under stress. And again, those public facilities are closed, but are they still available to residents who need them?
So that's a great question, Jessica. Thank you for that. Our Center for Health and Rehabilitation has reduced its hours. It has not completely closed. It is open on Tuesdays and Thursdays from 8:30 to 5:30 a.m., but it's only accessible to existing clients of that center, and we open it for the purposes of medication and refills, as well as injections that need to be provided to our existing clients. If you need to speak to a counselor or have behavioral health support, any day, Monday through Friday, between the hours of 8:30 and 5 p.m., you can do so through our telemedicine, which we have put in place to accommodate this virus. Again, that's from 8:30 to 5:30 p.m. Monday through Friday, and the telephone number for adult services is 470-230-0840. If you are looking for adolescent and children behavioral health services, again, those can be provided through telemedicine, and the telephone number to access those services for children is 404-612-9339. Our partners, River Edge for adult services and Chris 180 for adolescent services, are here to continue to provide individual therapy to our clients, and that's the way that they can access those services. The other thing I'd like to add to that is for those individuals that are in crisis and do need immediate medical attention to their crisis situation, I would encourage everyone who's in that situation or scenario to contact the Georgia Crisis Access Line. That telephone number is 1-800-715-4225. So existing clients, again, can maintain their services through telemedicine. We're also accepting requests for prescription refills. They can access that at the Center for Health and Rehabilitation the 2 days that it's open, but they can also contact their provider by those two numbers that I provided before.
Thank you so much, Ms. Church. I think Chairman Pitts wanted to add to that.
No, I didn't want to add to that, but I did want to go back to the previous question. I wanted to ask if Dr. Carroll could talk about PPEs from Grady's point of view.
Oh, sure. Thank you. Dr. Carroll?
Yes. So from our point of view, for the general public, we don't recommend walking around with gloves and face masks, because really, if you're sick, you should be staying at home, and a surgical mask really keeps in infection. And so that's its purpose. And so if someone's walking around, really, if you're coughing and sneezing and having symptoms, you should stay at home. Our system has supply right now. We are been well supported. And so right at this point, we are taking care of all of our patients and our healthcare workers.
Thank you, Dr. Carroll. So while we're talking about vulnerable populations, I might ask our county manager and chairman to talk to us about some of the things that are being done to support seniors as well, who may be isolated during this incident.
So the principal thing that I mentioned earlier is our focus right now is on food delivery. So we've started with our most vulnerable senior population that was participants in our either adult day or neighborhood centers. We surveyed each of them, and as I said a moment ago, about half of them have indicated an interest in meal service, and we have those beginning this week, so they can get a 5-day package of meals, as well as a daily service. So as we continue through our list of seniors, I think we'll be doing likewise curbside delivery, and we're also going to use our provider TransDev to deliver to home. So it'll be, I think, a very robust set of offerings. What we've been challenged to do is really look beyond our centers and our senior population to specifically some of the high-rise locations that seniors live in today, and meals aren't readily available. So we're working with Atlanta Housing Authority to both look at that population, look at the ones that desire a meal service, and then design a program that will deliver meals, probably using both providers and our own employees to do so. So that's coming in the next week or so, and we're very excited about the potential of that program. The chairman has been involved in those discussions. I don't know if you have other comments.
I think you covered it, but we are very aware of the so-called most vulnerable among our citizens, and that's factual. And I won't get into that. I'll leave that to the to the physicians that are with us this evening. And I happen to agree with that because I follow the advice of the medical professionals. But it does, though, give me an opportunity to challenge our young people who may be listening, our millennials who think that they're bulletproof, and we've all been there, and they're not bulletproof because there are cases that we hear about every day now where a young person, and in fact, sadly, just before we began this town hall meeting, word came that the young 12-year-old, and I happen to know relatives of the young 12-year-old, passed away today, and that is a 12-year-old. So the notion that it can't happen to you, that's simply not true. We're all in this, we're all vulnerable, and I heard someone say, a physician, that we should all treat this as if we have it and do not want to give it to someone else.
Thank you, Mr. Chairman. And that's a great segue to another question we received actually a number of times. And Dr. Ford, if you could speak to this, a number of people have asked us why we don't produce hotspot maps, or why don't we show more precisely where cases are located in the community. And I understand from a public health perspective, there are reasons that that information is not provided. Could you speak to that?
Sure. Well, there's a couple of issues. Number one, we're still trying to protect the privacy of individuals who test positive, but also sometimes a diagnosis is made in a hospital that may be in one county, but the individual actually lives in a separate county. And so that sort of complicates reporting structures because, for example, Emory may say we had 5 today, but 3 may be in DeKalb and 2 may be in Fulton. So it complicates reporting a little bit. But right now, the numbers are still small enough that I feel like if we start indicating by zip code, it would be somewhat easy to identify people still.
Thank you. We've also received a question that's somewhat technical about Medicaid and allowing providers to conduct telemedicine appointments from their homes. I don't know if that's something that you or Dr. Carroll might be able to speak to, why, if there's any review at the federal level of allowing counselors, for example, or psychologists to conduct those kinds of visits from their home instead of from their office.
I will turf that to Dr. Carroll.
So CMS has relaxed their requirements for telemedicine because of this crisis. This has enabled us and other health systems to quickly implement telemedicine in a way that we were not able to do before this crisis. Prior to this crisis, a patient had to be in either a rural site or they would have to start the visit at a doctor's office to another doctor's office. So they waived that rule. And so now we are able to do virtual phone check-ins and video visits more easily.
Thank you, Dr. Carroll. That's very helpful. We also have a question for Ms. Beckwith. This is regarding an individual who has an S Corp and is the sole employee and is wanting to know if this person has no revenue coming in and wants to know if they are able to essentially file an unemployment claim, although they are the sole proprietor of this business, given the circumstances and the modifications in Department of Labor requirements.
In order to qualify for unemployment, the individual would have to have been paying into unemployment taxes on himself. So I'm not sure if that is the case. If that is the case, then yes, that individual could potentially qualify for benefits.
Thank you. And we will follow up with this individual by email as well. We've also had some questions Dr. Fortis and Dr. Carroll, as people are looking around the world at how the virus has been responded to, and one question is mentioning about the test, trace, treat model that has been used in some other parts of the country, or parts of the world rather. Could you speak to how that is being implemented here, or if that is the model that's being used in the United States?
Well, as I mentioned earlier, right now we lack sufficient tests to perform that model of test, trace, treat. And so we are trying to manage with the supplies that we have. I think that there has been some success with that model, but because that is currently not an option for us, we're going to simply have to come up with a different way of managing this disease. It is our hope, though, as more laboratories gain the ability to perform tests, that we will expand our testing capacity, and that will help to determine who should be isolated, so that we can slow down the spread. But right now we are still in a holding mode as we wait for approvals for labs to be allowed to test.
And along those lines, another person asked about testing facilities. There's one drive-up testing facility currently in Fulton County. Others are being explored. Is that correct?
So let me be clear about terminology. So we are doing a specimen collection facility. The Board of Health does not have tests. What we have are test kits supplied to us by either private labs or by Georgia Public Health Lab. Those test kits contain the specific medium in which the specimen is collected, so it goes directly to the lab and it's run. We have some generic tests collection material also, which we are sending as well. Those tests take longer to come back because they're not in the specific medium to test COVID-19 in a rapid way. So we have a number of different ways to collect.
And longer term, do you think that more sites will be open as this continues?
Absolutely. Laboratories are receiving what is called an EUA, which stands for Emergency Use Authorization, so that they can be allowed to develop tests without some of the usual restrictions and timeframes that are normally required to set up labs. And I think as more EUAs are granted, we will have the opportunity to provide more testing.
Thank you. This is a general question. I don't know that we have specific expertise on this, but we've had a question about price gouging, and particularly products like hand sanitizer, cleansing products, toilet paper, things that have become in very short supply, and residents are starting to see price gouging in their communities. Is there a specific recommendation about what people should do if they see that?
So I want to speak to that from the health perspective for sure, because this current situation is an opportunity for a lot of fraud. There are bootleg masks being created, bootleg screening tests, bootleg testing kits, and sometimes they target our populations that are most anxious. And so I want to caution folks to make sure that anything you're purchasing has been approved. All masks are not the same. All test kits are not the same. And so we're very concerned in the health community about this. I get ads every day and offers of, we have this and we have that. And so I'm concerned that these are being targeted to folks who are just very anxious and maybe getting a false sense of security from what they're receiving.
Thank you. So one last question, Dr. Ford, for you right now is regarding, this is an individual who needs a permit from the Board of Health for a septic tank and has been asked to report downtown for that. Is there an alternative for online processing of those environmental health permits, or can you speak to any modifications in that permitting process as your department is responding to this issue?
So this is a constantly changing environment. So what we are doing currently is suspending all routine inspections for the next 2 weeks. but that's a restaurant and hotel issue. In terms of permitting, we are trying to identify ways to provide permits with with still increasing physical distancing in the community. And so stay tuned for that. We recognize that that's a problem, and we will try to identify an online method to allow for permitting.
Thank you.
Jessica, could we just add one comment to the price gouging question?
Yes.
Just mentioning to the chairman, the state asks for any citizen who sees price gouging on a product, not medical or non-medical, to contact the Attorney General's office. So I think that'd be good advice for anyone to follow.
Thank you. Thank you very much. We've also had an individual, this is actually a Fulton County employee, who's asking about some of the leave policies. So Fulton County has put in some leave, is making some updates to leave practices. Could you just in kind of broad level terms outline what has been done, and maybe employees will expect to hear more from you soon?
Yeah, so generally in terms of our leave practice, and I think we were ahead of the curve in developing a COVID-19 set of policies that allows for employees, if impacted by the disease itself, a close family member being impacted by it, having to be out of work due to a child's school being closed, or if it's in fact your facility is being closed. So for all of those reasons, there is a bank of hours, 80 hours, that an employee can tap into. But over and above that, through the end of this month, we have approval from our board to continue our pay policies in a consistent manner, meaning if you're either in a essential position and reporting to work here, or you're teleworking, or you don't have the ability to telework, our pay is being maintained. What we will be recommending to our board is how to review that going forward. So no decisions past the end of the month at this stage, but I do believe we've treated our employees always fairly and with the thought in mind that they are our most valuable resource in terms of serving citizens. So we will be monitoring closely both the status of this event, because I think, as Dr. Ford has said and others know and have said as well, the duration is probably one of the key issues. So from an employment perspective, that will be factored into our decision making, but also factored in is, again, the value that our employees bring, the difficulty of replacing them, quite frankly, and the ability of the government to function without them if there was some fall off in pay. So we'll be working through that. And again, more to come in the next week or so as those decisions are made.
Thank you. We also have a question for Ms. Dennison from the SBA about, and I'll just wait till we pull her up. Ms. Dennison, we have a resident who wrote in who'd like more information about the eligibility of nonprofit organizations to apply for SBA loans.
Okay. Well, first of all, they have to be a private nonprofit, so it can't be quasi-government or governmental entity. So that leaves it pretty broad in terms of who could qualify. The only main exception I can think of is religious institutions or institutions that cater to a particular type of religious doctrine. Those are not eligible.
Thank you. Thank you, Ms. Dennison. And another question we received, and again, for Dr. Ford, is about when the numbers are reported on the Department of Public Health website about the number of cases that have been identified, does that include the number of people who have been tested as well? Is that information available to the public in terms of the number of folks who have been tested but perhaps did not test positive?
No, because that number is unavailable to us because commercial labs also test. And so we don't know how many tests commercial labs are running. It's hard to keep track of that. And so at this point, it's all we can do just to track positives. So we track positives that come through Georgia Public Health Lab as well as through private labs.
Thank you. And a similar question is about if an individual like a federally qualified health center or a community-based health center was interested in being a testing site in the future, is that something that they could contact your office about for more information?
They wouldn't even have to contact our office. In other counties, federally qualified health centers are already performing screenings and tests.
Great, thank you. And we have more questions coming in. Again, we've talked about employee leave, but Mr. Anderson, could you also talk about some of the things the county is doing to expand teleworking and use of information technology, things like this meeting tonight, for example, or other things that we're doing to use technology to serve folks, and specifically how we're trying to empower employees through technology?
So I think we're all learning how to do business differently and serve citizens effectively without necessarily having to be in an office. In fact, the chairman and I have talked quite a bit about this subject and how it may be the start of really a fundamental shift in society where being in the office, and by the way, contributing to the congestion problems with Atlanta traffic, perhaps could be looked at in a different way. So as we found, the ability to teleconference has been quite effective. So we hold now, it seems like a teleconference between the chairman and I once an hour with key leaders all throughout the day. And I think that's going on at multiple levels. So that basic technology and I was a telecom executive, but that basic technology that's been around for years is still new again, I guess, to use a phrase. The other thing I think is the medium that we are using tonight, where video conferencing truly enhances the overall experience. And with our board meeting last week, we did it exclusively by teleconference. We're now looking for the next board meeting to use this technology, which, by the way, of course, is readily available and clearly effective and can be used in a broad-based sense, in that the app can be downloaded to anyone's computer. So we'll be looking to use video-based technology, I believe, going forward at our Board of Commissioner meetings. Another place where it's becoming critical, and so it's not just a convenience, but it's really a safety factor, is in our court proceedings relative to our jail population and inmates. So heretofore, we were still doing limited court operations or court services, but we were doing those with some personal contact. Effective tomorrow, we are exclusively going to a video-based service for first appearance, for example. And I think that is just, again, clearly a demonstration of how the technology can be easily ramped up and used effectively for what otherwise are some fairly complex negotiations and legal proceedings. So we're very pleased to see that happen. And then fortunately, I would say, and again, with the board's support and leadership, we updated our website in the last year. And that's proved to be critical because our website, quite frankly, was outdated, was not well positioned to serve citizens in terms of both information that they were looking for, but more importantly, perhaps the completion of services that they were attempting to do. Now that website has been brought into the future. And I think if you go to our website, and I would encourage you to do so, as a citizen, you're going to find many of our services are available for online access, as well as completion of whatever task you're looking to complete, ranging from tax services to library services, even to, we were looking just the other night for our own for a pet license update, and it's available on our website. So again, I would encourage our citizens to use our digital services to their fullest extent. And because our board made this investment within the last year, and Jessica, quite frankly, under your leadership and Bridget Bailey and others in our organization, we have brought many of our services again to the 21st century for digital access. So there's, again, many examples. I won't go into any more, but I think citizens would be pleased as to how their government is embracing technology.
Well, and along those same lines, thank you so much for that. I'm going to ask Ms. Roach if she could answer a question that we received from a from a resident who wants to know if they can get a new library card online. Libraries are closed right now, and residents can't get a library card in person. Many people have children at home who could benefit from library services. Could you tell us what is available online, Ms. Roach?
Sure. Thanks again for that question, Jessica. And the answer is yes. If you are not already a patron of our library system, you are able to go online and fill out an application for a library card and receive one that way. As the county manager stated in, I believe, his opening remarks as well, don't forget that we have a huge circulation within our system of online materials. So if you are at home and you are looking for things to do, please use our digital resources at our library. One thing that my son, as an anecdote, accessed the other day to assist him with his digital learning was an online tutoring service that our library offers as well. So again, there are multiple opportunities. Please take advantage of our website to browse what all our libraries resources are that you can access online. But yes, to answer your question, you can go online and apply for a Fulton County Library card.
Thank you so much. Another question we've just received is about, and again, Dr. Ford, on the testing issue, many people are confused about who gets tests. What does it take for a person to qualify to be tested?
So that's a great question. I'm glad you asked that. I would love to clear that up. So currently, based on the limited number of tests that we have available, there is a priority list of folks who are at this point eligible to receive specimen collection. So that includes our individuals who have been referred to the Board of Health or through the Georgia Department of Public Health from their primary care provider. They would have what we call a PUI number, person under investigation. That number allows them to be put into the queue for specimen collection. That is one method. The second level of priority are our first responders, for obvious reasons, or symptomatic, because they are exposed to so many people that we want to be sure that they are fast-tracked into getting appropriate testing, so we know whether they need to be isolated out of the rest of the population. The next level are our healthcare workers and those other individuals who care for vulnerable populations, so that we can make sure that our workforce who is working the front lines stays healthy. So those are the three priority populations right now, but we are also working on methods to ensure that our homeless population are also safe, and that we make some provisions also for our inmates to be tested.
And actually, that's a great follow-up. We had another question specifically about jails and places like that. We at the Fulton County Jail are taking some measures to protect inmates and as well as the employees working in the jail, and wondered if any of you could speak to that.
So, as I mentioned earlier, and Anna Roach can also add to this, but I think the Sheriff's Department is taking extraordinary measures to both protect the general population at the jail as well as their employees and deputies that man that facility. First of all new entrants to the jail are tested for temperature as well as observation outside of the jail itself. So actually in what's called the Sally Port, where those deliver, or where a person is brought initially. Number two, they are quarantined for 14 days upon entry. So they are kept out of the general population, which of course is very helpful if they were asymptomatic upon entry and then develop symptoms over that period of time. So either if upon entry or during that quarantine period, if they are shown to be symptomatic, they would then be diverted to a medical facility. Lastly, as I mentioned, we did have one inmate that was diagnosed COVID-19 positive in the last week. So in that particular case, we have done the contact tracing, and fortunately he was quite isolated even before the event or before this was discovered. So there were very few people that he was in contact with. The staff that he was in contact with had been sent home. The inmates that he were in contact with have been quarantined, and he himself is now in quarantine. So the good news in all of that, I think that's been relatively contained. We still do concern ourselves and are developing worst case scenario planning, not only as it relates to our jail, but also as it relates to the general population. And in those kind of scenarios, we'll have to look at all options, and the chairman's involved in discussions with other jurisdictions and political entities that could be helpful. So I'll leave that perhaps to another time. But at least at this stage, I think we are doing everything that we can to protect our inmate population and our sheriff's office employees.
Thank you so much. Along the lines of kind of while we're still talking about these congregate spaces, we've had some questions about businesses like malls or other large facilities where people gather, even parks and places like that. What impact would today's order from the or declaration, Dr. Ford, what impact will that have on those kinds of businesses?
Well, a lot of the malls in Fulton County are already closed, the large malls. This prohibits gatherings of 10 people or more. And so that would certainly apply to malls. It's a delicate balance of trying to encourage some level of physical activity while we remain locked down. And so we're not telling people to not go outside. We're telling people to avoid being around other people. And so that means not gathering in large numbers in parks. You can still go outside and walk. You just don't walk with 8 to 10 people with you. And even if you walk in a group, which of course is a necessity for safety sometimes, you need to have the appropriate physical distancing from one another so that you don't increase your risk of infecting each other.
Thank you. Another question we got was specifically related to millennials. And Mr. Chairman, you mentioned this earlier. What advice, and perhaps this is something others on the panel may want to speak to as well, but what specific advice is there for folks of our younger residents, whether that's Generation Z or millennials, who may not believe that they are affected by the virus?
I think the simple answer is it's information. Early on, when we heard so much about the most vulnerable among us, meaning I guess the elderly and those with certain pre-existing conditions, but what we have found and what the medical professionals have found and following their advice, they have led us and the world to believe and to know that it's just not restricted to seniors, that young people are in fact susceptible as well. But in addition to being susceptible, they need to be aware of their parents and even their grandparents. And so what I have been attempting to do, and I take pride in the fact that a lot of the millennials refer to me as an honorary millennial, that they need to get involved, and it's the information that's important. We're looking to spread the word to them through other millennials. For example, utilizing our sports stars, the young ones. The one guy who's probably the most visible right now is Trae Young of the Atlanta Hawks. Has done a video. We're sort of piggybacking on what he's doing and working with him. We have probably one of the #1 rappers in the world, Lil Baby, trying to get him to do something quickly that will appeal to young people as well. And I want to go back to what I said earlier. The young lady, 12 years old, who passed away today, that should be a wake-up call to all young people. And bringing it closer to home, the husband of a friend of my daughter's, who would be in his 20s, is now positive, no fault of his own. It just happened. So no one is invisible to this. So it happens. We just need to be aware, and young people, and I get, my wife and I talk about every time we see that scene from the beaches in Florida with the kids dancing and party and that one, I mean, I'm sure that girl's parents are going to have something to say to her when she goes home, whenever she goes home, about being out and being photographed doing what she was doing. So it's in the end, I think it's information, and we're doing what we can to get the word out to millennials.
Thank you.
So
Dr. Ford wanted to.
I have a 19-year-old home from college because the schools are closed, and that age group think they're invincible, and they're bored to tears because the gyms are closed, and so their only outlet at this point is to visit one another. And so I had to put a stop to that this past week to explain to him the concept of being an asymptomatic carrier, and the fact that even though you may not have a cough or fever, you may still have the ability to pass that on to someone else, namely your mother. So we are really trying to help them understand that even though they may not have the symptoms, and we are seeing young folks with this disease. And so I think he had a sobering look when he's, seeing folks his age starting to get this. And I think he's finally getting it. And I hope that the rest of the millennials are understanding this too. Nobody is immune from this. And the thing is, we learn about this every day, because the first line of thought about this was that pediatric population seemed to have milder effects. That has not been proven to be true across the board. This is a novel virus. We learn something new every day. And the thing about a novel virus that's most worrisome is that nobody is immune, because it's brand new to everyone.
Thank you so much. We have another question for Ms. Beckwith. This is regarding any available benefits, perhaps for gig workers. We have many folks in our community who are Uber drivers, DoorDash drivers, all of those kinds of freelancers. Is there any kind of unemployment benefit that may be available to them?
Most of those people are considered what we call independent contractors. That kind of goes along with when I responded before. If they were paying unemployment taxes on themselves, they could possibly qualify. Also, if they were doing any other work that an employer maybe have been reporting wages on them. My best advice for anybody is to go ahead and file your claim. That way you will get a determination. And also there are things that I know Congress is working on. So you really need to listen. And some of the things they're working on are for the self-employed, independent contractor based employees.
Thank you so much. The next question is for Dr. Carroll, and it's about, can you tell us kind of what is the number or kind of the load of cases that you're seeing at Grady right now? Is that something that you all are concerned with?
At this point, our emergency room volumes are steady, and we're able to handle the load of patients that we are seeing. So we have plans, just like the county has plans in worst case scenarios, and we're prepared for what the future may hold. But for right now, our hospital emergency room is doing well.
Thank you so much. I'm going to send the next question, or ask Ms. Whitmore if she can assist us with this next question. And I know personally that this is, we may not have an answer yet for this, but we've had a number of folks who are concerned about vehicle tags and things like that. Can you tell us, people who are just renewing their tags, they are able to do that even while the tag offices are closed. Is that correct?
Yes, Jessica, that's correct. They are able to renew currently online by going to the tax commissioner's website directly, or through any one of the kiosks in select Krogers throughout the county.
Thank you. And for folks who have emissions are not something that the county issues. Is that correct?
That's correct. You would have to go to an emissions inspection center for that.
Thank you. So bottom line, people can check the Fulton County website. We will provide the most current information we can about that. Dr. Ford, we had a follow-up to the question earlier about community health centers. if there's a community health center that is not a federally qualified health center, are they still able to perhaps become a testing site at some point? They're just an independent community-based health center.
I can't speak to that. That would be through the Department of Community Health, I believe, that would regulate who can test as a center.
Thank you. At this time, we have not received any additional questions. We may just ask if any of our presenters would like to make a final remark, and then we will conclude, Mr. Chairman.
Okay, anyone? Final remarks?
So I'll just say this declaration of a public emergency, while some will consider it an inconvenience, is really a very, very sincere effort to try to keep as many of this community safe as possible. This is not a long-term issue. This will be in place until the numbers drop and the general leadership in the medical community is satisfied that we're on a downward trend. But be assured that this is not put into place to inconvenience any individual. It is truly a measure to provide the maximum level of safety to all of Fulton County's citizens.
Any other final comments from any of you?
Dr. Carroll?
Yes, I would also like to share the state's COVID-19 hotline number for further questions. And the number is 844-442-2681. Again, that number for the state COVID-19 hotline is 844-442-2681. Thank you.
Thank you. Mr. Chairman, if I could ask one final comment we've received. People want to know, what is the role of the Board of Commissioners in responding? Could you just speak to a little of that as you kind of wrap up this evening?
Well, the board, we're the policy making body for Fulton County, and we will have to weigh in on this. I've been here every day since since it began, quite frankly, from 8:30 in the morning until about this time every night with the manager. Now, we sort of joke that we're just sort of joined at the hip. But I'm looking at what he's doing, what his team is doing. We maintain the proper social distance while we're here, at least we try to anyway. And I think most of the time we succeed. And what we as a board will have to do, will be serious about this. And we are, and I think we're going to take this very, very seriously, looking at first and foremost, the safety and the well-being, the health of the 1 million plus people that we represent. But we also have 5,000 people who work for Fulton County. We're obviously concerned about them, their health, their safety, their welfare, and their employment. So the manager mentioned earlier, we put in the 80-hour policy early on. We ratified that, but that's going to run out soon. And I believe at our next meeting, which will be next week, the board is going to have to review that and make some decisions as to, do we go further, do we extend it, or what do we do? But first and foremost, we have a very good professional working group, 5,000 who work for Fulton County, and we certainly want to take care of them. But by the same token, we have to be fiscally responsible with the taxpayers' money. So it's going to be a very delicate balancing act for us. But the Board of Commissioners is in fact engaged. I mean, I talked to Vice Chair Arrington. I spoke with him today. Councilmember Carnes stops by. I know that other members talk to the manager on a daily basis. So even though we may not be physically present, we are, and all of us are engaged. I may be here as the face of it, but all of my colleagues are in fact involved, and we will be talking in more detail about what our role is going. We know our role, but what specifically we plan to do to make sure that we protect the million plus that we serve, plus the 5,000 people who work for Fulton County.
Thank you, sir. Mr. County Manager, anything you'd like to add?
No, I mean, I think all of us recognize that this is, again, a situation that none of us have faced before, and its duration and severity and, of course, impact on on the life and health of citizens is paramount. So I think the attitude that we're taking is to act and adjust as we go, because there's not a playbook for this. But hopefully the citizens can see through communications efforts like this, and of course the underlying service delivery emphasis and emphasis on public safety and public health, that with the Board of Commissioners leadership and guidance, we're in it for the long haul.
Thank you.
Let me just add too that, Fulton County is made up of 15 cities, and one of the actions that I took today was to encourage all 15 cities to be on the same page with respect to rules and regulations, and the fact that the Dr. Ford and the Board of Health issued the public health emergency. That gave us and her more latitude to do what she has to do. And our role then is to encourage the other cities to adopt uniform, consistent regulations so that citizens will know what is permissible and what is not permissible. That's with respect to the 15 cities. In addition to that, we meaning my counterparts in Cobb, Clayton, Gwinnett, and who am I missing? Henry and Rockdale. We talk 2 or 3 times a week. And the reason we talk is to find out, I want them to know what we're doing. I want to find out what they're doing. And if they're doing something that we're not doing that makes sense, we need to do it, and vice versa. So we're all in this together. Because if you look at it, the probably 10 or 11 counties in the metropolitan Fulton County area here, we represent probably 40% of the population of the state of Georgia. And with Fulton County now having 100, and what was the last number? 184 cases, we are the epicenter. So we have a role to play. We're obviously following closely what's happening at the federal level. We're watching closely and following what's happening at the state level. But the governor has set some parameters, but he's also given us at the local level the freedom to do what we think is best for our constituents. And that's what we're doing. And that's what I'm sure that my colleagues on the Board of Commissioners will be doing as we move forward.
Thank you, Mr. Chairman. I want to mention that we received a question about that's really best answered by some colleagues at the school system. It's about proms and graduations and things like that. Of course, seniors are disappointed by the impact on some of their activities. We can certainly follow up with our counterparts in the school system. I don't know, Dr. Ford, if you have anything to add to that.
I don't. I did want to take this opportunity, though, to thank the public health community, our hospital workers, Grady and all the other hospitals, all of those who still come to work to provide the essential services despite the closures. Your efforts are appreciated by all of us, and we are all praying that this is over very soon so that we can all get back to normal.
Well, I think that answers the questions we've received tonight. Thank you to each of our presenters, those in the room and those who joined us virtually. We appreciate your time tonight. And with that, if there were any questions we received after the closure, then we will follow up with those folks via email. Again, thank you to each of our presenters.